I think one thing that probably prevents people from getting checked is they're worried they're going to have to they're going to be embarrassed or have to get undressed. And, that is true, but it's worth it. The 3 types of skin cancer, the most common is basal cell carcinoma. The second most common is squamous cell carcinoma, and the least common, but the most serious, is melanoma. And the melanoma tends to be a pigmented mole that's changing, so it's usually got some degree of jagged borders, some degree of asymmetry, which means kind of growing off to one side more than the other. It's not symmetrical. Maybe some color changes within it, so maybe it's got 2 or even 3 colors within it. Basal cell carcinoma can look like a variety of different things, so it doesn't look the same every time. I would say in my clinic, the most common presentation is sort of a bright pink, kind of pretty pink little bump that shows up. And sometimes it can actually not even be a bump yet, it can be flat. And then it'll start to scab a little bit. And then maybe if it's been around long enough, it may even start to bleed easy. So things that bleed easily can be something you want to have checked out. Squamous cell carcinoma tends to present as a bump that can sometimes come on quickly. It can be thick and crusty. Sometimes squamous cells are painful. The most common risk factor for all of them, of course, is sun exposure and lifetime sun exposure. We get a lot of our sun exposure in our teens, 20s, and 30s, and then it comes back to haunt us in our 40s and 50s and 60s. So there is a delay between exposure and when the skin cancers show up. But sun exposure is by far and away the most common. Tanning bed use. People used to tan quite a bit in the 80s and 90s. Of course, that's less common now, but the desire to be tan is very popular, particularly among young people. There's no such thing as a healthy tan. Anytime your skin is tanning, it's actually your skin's mechanism for protecting itself. What happens is, on a cellular level, your little skin cells, when sunlight hits your skin, it breaks the DNA bonds. And what a tan is it's your skin's way of trying to protect itself from getting broken. The best prevention against skin cancer, of course, is wearing sunscreen. Even better, covering up those areas that can be covered up. It's an acquired taste, I say, but wearing long sleeve shirts out in the sun, covering your skin, broad rim hats, and then the areas that you can't cover up, like maybe your face, wear sunscreen, put on sunscreen on a daily basis. SPF 30 every day on your face is recommended, or in areas that are exposed. So that could be even your hands or arms, depending on what you do and how much you're out in the sun. But putting on sunscreen and then reapplying. A lot of folks, if they're going to be out in the sun at the lake or something like that, they often don't reapply. Not starting that too late in life. You want to take good care of your skin when you're young. So starting those habits early on, I think, is helpful. And then just being aware of your skin, knowing, not ignoring things, knowing what's normal on you, and that way you can know if something's changing.